Hello everyone, my name is Emmitt Griffith, and today I will be giving a speech on California prison healthcare reform. Today in my audience I have my son Emmitt who's recording, and my dog Nella, and my wife Nicole. Okay, I will begin. As some of you may know, I am an LVN that currently works for the state of California at the Correctional Healthcare Facility in Stockton. Today I will be discussing the topic of healthcare prison reform. Over the past few years, I'm sure some of you have seen this topic in the news. I will be giving an overview of the current and previous state of the prison healthcare system. I will discuss the pros and cons of providing acceptable healthcare to the inmates of California. I think that it is important for everyone to have equal health coverage. My goal in this speech is to explain why the prisoners of California deserve acceptable health care coverage. I want you to imagine that you or a family member made a terrible mistake and was sent to prison. And while in prison, you or that family member got seriously ill and was not able to get the medical care that you needed. How would this make you feel? This is what was happening in the California prisons up until 2002. Okay, now I'm going to talk about what the healthcare reform is. On April 5th, 2001, a complaint was filed against the state of California. The alleged deficiencies included inadequate medical screening of incoming prisoners, delays in or failure to provide access to medical care, including specialists, untimely responses to medical emergencies, the interference of custodial staff with the provision of medical care, the failure to recruit and retain sufficient numbers of competent medical staff, disorganized and incomplete medical records, a lack of quality control procedures, including the lack of physician peer review, quality insurance, and death reviews, a lack of protocols to deal with the chronic illnesses, including diabetes, heart disease, hepatitis, and HIV. On June 13, 2002, the state of California was ordered by the federal court to provide the minimum health care under the 8th Amendment in the state's 33 prisons. The state of California failed to comply. In April of 2006, the federal court appointed a receivership to take over the responsibilities of developing a new healthcare system. According to the California Correctional Healthcare Services, the receiver's responsibilities were to provide medical care to 125,000 inmates, develop medical care at 34 adult institutions in California, oversee more than 9,000 medical care positions, oversee the opening of the California Correctional Healthcare Facility in Stockton, California. The cost of providing health care to the inmates of California. Before the federal court appointed receivership took over the prison health care system, California spent over $600 million a year on inmate health care. The money was mismanaged and there was a lot of wasteful spending. This was partly because the people in charge was not medical. The people in charge was the California Department of Corrections and Rehabilitation. But now, the federal court appointed receiver found ways to save the state of California millions annually just by cutting this waste. For example, by having doctors and specialists on site, the state of California has saved over $200 million to $400 million a year because inmates no longer need to be driven to their appointments out of the facility by officers. Now the cost for health care is about $10,000 annually per inmate. pros and cons of providing inmates with health care. There are several pros and cons to providing inmates with quality health care, but I have a few here. The pros that I have written down are prevent or stop the spread of disease, lower the number of lawsuits, save money. Some of the cons were the cost of starting a new healthcare system, running a healthcare system, and getting qualified medical professionals to work in a prison. Today, I have talked about prison healthcare reform. My goal was to get you to support prison healthcare system reform in order to keep inmates well so they can focus on rehabilitation. I provided an overview of the prison healthcare system. I have talked about the cost and some of the pros and cons of providing inmates with healthcare coverage. I understand that not everyone agrees with providing healthcare to inmates, but understand the Constitution says that even the worst of us deserve a basic quality of life. Thank you for being here with me while I deliver this speech. Thank you. Bye.